Welcome to the ambulance suppliers using the form CMS-R-131 Advanced Beneficiary Notice of Non-Coverage or ABN webinar. This webinar explains the important information on ambulance suppliers using the ABN. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter. Today I'm joined by Ashley from my team, and she's going to help me with that chat, adding some links, answering those questions, reading them out to me, all of those fun things that will happen. So a couple of things you might want to be aware of. First, if you are interested in downloading the presentation, you can do so now by going to our live events page in our training center. This live events page, you'll have to locate on the chart the event and then go ahead and select the download materials button or at the end button. What we want to make sure that you do with that is have it available to you. It is not a required item. Again, not required. You can send questions in chat. We will stop at various points and take those questions. We will also have a final wrap up for questions. So please make sure that any questions you have, you put them in chat, but please make sure you do it as you go. It's just important to get those questions answered before we get too far into it so we don't have any confusion. We will also be asking you to take a survey after the event. The survey gets to grade us on the good, the bad, and the ugly. And what that means simply is tell me what I, as your presenter, did well. Also, there'll be a general question about WPS as an overall company and a MAC and how we did. Then the bad. Tell me what we did bad. Look at the presentation. That's the ugly, if you want to call it that. That's what I like to refer to it as. Did you like my presentation? Were there things I could have done to make it better? All of that will be incorporated onto that survey. But one last thing, don't forget that that survey is a great opportunity for you to tell us what you need in education. One of the biggest things that we get on there when it comes to ambulance suppliers is they simply say ambulance education. That doesn't mean anything. We don't know what you want with ambulance education. We do on average 6 events a year, some of them more fully in the end of the year, some at the beginning of the year. But if I don't know what you're looking for, I can't help you. So please add more than just the word ambulance education. A little bit about this program. This program is designed to be an educational tool. It does not go over it is not designed to be the official Medicare rules and regulations. Those are available on the CMS website, and we will be taking a look at some of that information as we go through the program. The answers that I'm going to give are going to be based on the questions that you gave me. Now, the reason that I state that is because with Medicare ambulance benefit, simple items, very little pieces of information that are given or not given can change the answer. We're going to talk about that when we get into medical necessity and some of the information you'll need for that. Okay. Again, access the CMS website for current rules, laws, and regulations. The picture on here simply means please don't record any of this. We will be recording it. That means no screenshots, no recording, no any information like that. We will actually be doing that for you, and we will post it as an encore presentation on our YouTube channel. Once that's done, we will add it as the encore presentation on our website, encore presentation page, and repost the PowerPoint. So the PowerPoint will come down. It is available again on live events, but it's going to come down to be reposted when we post this as an encore presentation. What are we doing today, and what are we looking for? We are going to cover one form, and it's the CMS-R-131, which is the Advanced Beneficiary Notice of Non-Coverage, ABN. This form is used when ambulance suppliers use it is very specific use. It's not a general use form, but because of the questions we received, it did lead me to build in some really basic information and to talk about the form in a more basic manner. So I really do want to give the opportunity to do that. Again, it's just really in the questions that we receive that we're looking to do that. I also want to make sure that everyone is aware of where to find this form on the CMS website. It's great to know how to fill it out and to do different things with it, but if you can't find it, it's not going to help you in the long run. So we want to make sure that you know where to find it on the CMS website. Last, there were some questions that were sent in as part of the pre-submitted questions. Great questions. So we are going to cover them, and we want to make sure that everyone is aware of those questions. And then we also want to give you the opportunity to add any questions into the chat that you have. So we want to make sure that you can see it, ask questions, do what you have to do. All right. So where is the form, or what is the form? What is the basics of the form that you need to know as an ambulance provider? That's where we're going to start. Okay. So the basics. This is the CMS form R-131. This form is given in advance to let the patient make a decision, and we'll talk more about that. And the patient's decision is about whether or not they want a service to be done. It is dated 1/31/2026, which means that the Office of Management and Budget Review will occur. Usually every 3 to 5 years, this form is then reviewed, and if changes are needed, they're made. We're almost at that review period. However, I want to remind you that you would continue to use the form dated 1/31/26 until CMS tells you that there's a new form available. This form is not to be used for all services, and we'll talk about that, because if you use it for all services, all transports, and say Medicare may not pay this, we don't really know what's going on, it will make the form completely invalid even when it should have been given. It has a very limited use for ambulance services. I was asked for specific scenarios, and I'll give you the only one that I know of where it's actually used in a practical manner. Okay. As we said, or as I said, this is the patient's choice form. It allows the patients to make an informed decision on a medically necessary service if that service is above the needed level. Okay, so it does change the financial liability, and the financial liability is only changed if a correct modifier is applied to the claim. So we're going to talk a lot about a lot of these basic things as we get into this, but the basic gist of what I want you to remember when we talk about the ABN, or the Advanced Beneficiary Notice of Non-Coverage, is that it is still for medical necessity transports, medically necessary transports. Those transports are provided at a higher level of transport than is needed. Okay, so that's where we're really looking at it. If it's not that situation, then you don't want to give it. So that, and then again, it has to be the patient's choice. That's what the ABN allows. Do I want this service? Then want it billed to Medicare, or not billed to Medicare and I'll pay for it, or I just don't want the transport at all. We'll talk more about those options in just a few moments. Usage. There are two times when this is optional and mandatory. So there's two different times. One, ambulance suppliers can use this to give the patient liability for something that is above the medical necessity. My example, a doctor orders an air transport to a higher level of care. When the EMT arrives and does their assessment, a ground transport would safely get them there. Now, it's not just about medical, right? It could be about time, the amount of time it takes to get to the airport on a ground, then you transport the amount of times they get to the next hospital. All of that has to be considered. That is the type of mandatory use. I was asked for more examples of mandatory use, and I don't have any. I can't think of any time where we'd say, hey, we did this at a ground level, but it really should have been done at a lower level. Well, then you would bill it at the lower level normally, and so I'm not sure where that would occur. However, optional use is used quite often for ambulance. So again, mandatory use, one situation that I can come up with, the only one that I know. Optional use means this service is not covered by Medicare. It's excluded. How does that work? Under the Social Security Act, Section 1861 S7, it says that the ambulance service must be medically necessary for us to consider it. So that means that any other type of thing is not medically necessary. Well, how do they define medical necessity? How do they define contraindicated? And that is a transport that can only safely be done by an ambulance. So if they could safely have gone by car, taxi, wheelchair van, any of those, then it does not meet the definition in the Social Security Act, Section 1861 S7. Now, the reason that the S7 in that section is important, again, 81861 S7, is because in the directions for the ABN, which is in the Internet Only Manual, it says anything in 1861 is an optional use. In other words, you're giving it to the patient to tell them Medicare won't cover this, but it's not medically it's not that it's not medically necessary, it's that it's just not a part of the Medicare benefit package, period. Medicare will never cover this transport because it's not medically necessary. Unlike a service that would be covered or that can be covered partially because the ground would be covered, but the air portion would not, which is the mandatory use. Remember, it's medically necessary transport, just provided at a higher level than is needed for that patient. Okay. So let's go to our first question and answer. And I'm going to start with a pre-submitted, and then we'll see if you've submitted any questions. So part of the patient's choice is to sign the form. Now, if the patient cannot sign the form, who else can sign for them? So signing of the form can be done by anyone that's available, such as a family member, friend, neighbor, representative, power of attorney, etc. When they sign the form, they are not agreeing to accept financial liability. What they are doing is stating that the form was presented and explained to the patient, and it is understood that there is a medical necessity transport happening, but it's higher than needed. Higher than needed. That's it. That's all they got. They're not accepting financial liability. Okay. So hopefully that answers the question that we had there. If not, again, put some more questions back in the chat. And Ashley, do we have anything in the chat?
We do not have any questions in the chat yet.
Okay. We're going to move on to the next slide then. And the next slide is about mandatory use. So one thing I'd like to do is just stop for a moment and talk about mandatory versus optional. Because as we said before, there are two different times. So mandatory means that in order to change the patient liability, the ABN must be given and the appropriate modifier must be appended on the claim. The ABN must be properly signed and dated and available to Medicare upon request. It's like any other medical record. We don't need it every single time, but if we ask for it, then yes, we want it. Okay. So we want to make sure that we're going to go through that. I will go through in the mandatory use section some of the information on how to complete the ABN for an ambulance transport. So we're going to go through a little bit more on that. Okay. First, one thing to know about the ABN is that it's for outpatient services. And you're like, wait, how does that apply to an ambulance? How many of you have had your ambulance run bundled into an inpatient stay, whether it's at a skilled nursing facility or a hospital, anything like that? If it does bundle, it is not considered an outpatient service. It's actually considered a portion of an inpatient care. Therefore, it's not the patient's liability. One of the questions we got is, when it bundles, why can't we bill, and I'm believing this is billed from a hospital-based ambulance company, why can't we bill separately for the ambulance transport? A bundled service is included in whatever the end result is. So if you're going for an MRI, the actual transport to and from the MRI during that inpatient stay is part of the cost of the MRI. It's not a separately billable transport because how'd you do the MRI, right? How did you do it? Well, you can't do it if you can't get the patient there. So that bundling concept is where it comes from. So first, it has to be an outpatient service. One of the other questions that came up with outpatient, and I'm going to hopefully let you know that you guys use the right term here. If you didn't, you might need to ask a couple more questions. they stated that the patient was inpatient in an observation care stay. And does this apply? Well, first, inpatient and observation care are two different things. There must be an order either for inpatient or observation care, but not both. We will automatically default to inpatient, should the order say inpatient observation care. That's what we're looking for. Observation care is considered an outpatient service. Therefore, the ambulance run is considered separately. So I'm not really sure where you were going with that question exactly. So if you need more, let me know. Just trying to get kind of to the basics of it a little bit there. Then we look at medical necessity, and here we see the term contraindicated. In other words, it's the only safe means of transport. If a service is not the only safe means of transport, then you cannot bill Medicare for that ambulance service, and it is the patient's liability because it is not part of the Medicare benefit. It also does not go into a bundle. So even though they're inpatient in a hospital, it doesn't go into a bundle. A not medically necessary transport, for whatever reason, will always be the patient's responsibility. Here you can see the Social Security Act, and this is the section that I keep referencing back to you. What's nice is that if you click on 1861, it will take you out to the actual act itself. So I'm just going to do that. There we go. And it will open the website for you. It's an automatic link. It's really nice. When it does, it's going to open this up, and then you're going to look through A, B. Okay, and we're going to go to S. So look away if you don't want to watch the fast scroll. P, Q, R. Here is the term S. We drop down under 1, 2, and we're going to go to 7. And it says ambulance services where the use of other methods of transport is contraindicated by the individual's condition, but only to the extent provided in regulations. Only to the extent provided in regulations refers to making sure you have Medicare secondary payer, the forms filled out. So that's where we get the difference in a mandatory and a non-mandatory use. If it is not the only safe means of transport, then it is not a mandatory use. If it is the only safe means of transport and above the level, then that is when an ambulance company would be required to use an ABN. Would be required to use an ABN. So when we look at how does that then translate, and the services provided are what we're looking at that. So I will tell you, this is from CMS. They say if you're doing a basic life support and you do an advanced life support, then that will be a medical necessity denial for the advanced life support portion, but the basic life support is payable. I'm not sure that I've ever seen this happen, and I'm not sure to even give you a practical example of it. I don't have one. Keep in mind, if you do an advanced life support assessment, but based on that assessment, do a basic life support, that is still payable at the ALS level 1 or the advanced life support level 1. That's a separate criteria. So I don't really know when that ground portion. On the other hand, we do see this happen. Ground is a safe means of transfer, but travel is done by air. This is the more common use. Air ambulance companies give this to the patient to inform them that they will be liable for a portion of the transport. This just goes through a little bit more in the Medicare Claims Processing Manual. It's Chapter 30, which is the financial liability section, and 50.17C gives you a little bit more information about this. Again, I do not have a practical example for the first one because I can't think of one. I've never seen one come through. The second one we do see. Okay? We do. All right, that goes on to say, let's ask a few questions and let's use these questions then to determine. First, when the EMT assessed the patient, now remember, Medicare does not say an EMT is at a basic and an intermediate. Medicare also defines an EMT as a paramedic. So if you're saying, well, he's not saying paramedic and they did the assessment, therefore, no. Medicare gives us 3 levels of EMT. If your state does not use the term intermediate, but has a level in the middle, that is what Medicare will define as an intermediate. So terminology definitely may not match up perfectly, but I want to make it clear. Once the assessment is done, that's where you're going to establish the medical necessity. That means you're already dispatched, you're already on scene. Now you're looking at the patient. Once the patient has been checked, reviewed, talked to, the assessment is complete. Do you expect Medicare to pay at the level of service provided? This question comes from a doctor who ordered an air transport, but the patient could safely have gone by ground. Has that ever happened to you? So as an air company, you give an ABN to say, we don't see a medical need for this. Now the patient can allow you to file a claim, which is perfectly fine. And so long as the patient allows you to file a claim, they can do an appeal. They can do an appeal to say, we feel like this should have been medically necessary because our doctor ordered it or whatever the situation is. But you're going to base it on your assessment performed by your emergency medical technician. The next one will automatically mean stop, don't give an ABN. If the patient, is the patient under great duress? Great duress is the key factor. If they are, we can't give an ABN to them. So if you go into the hospital and they're stable, they do need to go to a higher level of care. Can you tell me if the patient's under great duress? Okay. Is the patient capable of understanding? We ask this for mental health patients. There are times when the patient has a mental health episode, they're in severe depression, they just don't have the capability of understanding what you're getting. They don't even get the explanation. If you document that, then we have an understanding of why you did not give an ABN. So hopefully that makes sense to everybody. Let's talk a little bit about completing the form. First, I want to let you know that I'm going to give you a little bit of information here. We're actually going to pull the form up and the instructions up on the CMS website because I think it's easier if I can actually show you where to go to find the instructions. We can talk about the form from there. So again, remember, limited use, but we still want to talk about it. So you do want to complete the entire form for a mandatory use. If it's an optional use, we'll explain which sections you want to do, but you might want to take a note that it is only A through F. And again, we'll talk more about that in a little while when we get in a few slides down. Okay, so when you go to complete the form, what else do you have to know? The identification number is your internal number, and we'll show you that in a moment. Your reason must be specific. You must estimate what you expect the patient will pay, and again, we'll talk about that. The patient does have to choose the option, should it be required, the mandatory use, and the patient does have to sign and date, should it be required, again, the mandatory use. Okay. So if I use the link, I can actually open up the ABN form and instructions. I'm going to take a second and instead go to the CMS website, which is cms.gov, and we're going to navigate to it. If you want the easiest way, you can always just search ABN and it'll pop right up as like the second or third hit, depending on what you're searching for that day. But to take you the long way so that you have all these steps, if you go Medicare and you scroll down, you'll see forms and notices. Beneficiary Notice Initiative. The ABN is a portion of the Beneficiary Notice Initiative. It is one of the forms underneath there. So that's why you're going to go to Beneficiary Notice Initiatives. Then you're going to come in and you can see the ABN information is here on the left. But if you scroll down, here you'll have the actual form, the instructions, and the form itself. Let's go ahead and open up the instructions. You can see it's a PDF document. It opens up and it walks you through, when you can make changes, all of that type of thing. I'm going to walk you through some key information, but I'm going to use the actual form itself. So if I do that, and I've already downloaded the form earlier because it is a zip file, you get to see the form, and this is what the form looks like. Okay. So here's where we were talking about the identification number. This is your number from your records, whatever it happens to be. Don't put the patient's Medicare number there. Don't put a Social Security number there. This could also be left blank. This is you as the ambulance supplier. This is the patient as it would be known for Medicare. Then you've got this right here, and this is very specific guidelines, and that is the D period with the underscore, the line. Yes, you can remove the D, the period, and that underscore, that line. That's perfectly fine. When you go back out, go back to the website, what do you have to put there? Right here. Item, service, laboratory test, test, procedure, care, or equipment. You're doing a service. So you're going to say transport service, or you could just say service. That's what you'd want to do. You want to then fill it out as best you can. So you're going to say service, 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 service. Okay. You'll hit this D. Now this is a little bit different, and this is where you want to describe the service. This is where you'll say ambulance transport. Something like that right here. And then you're going to give the reason. Now the reason can be something similar to, this is a never covered transport because you could go by a taxi cab, just as an example. Or this is an air transport, but ground is the safest method. In other words, we could take you by ground safer. That's what you're looking for there. Something very specific, but be as specific as you can. Then you're going to talk about the estimate. A couple people asked me on questions on this, so I do want to make sure I get this addressed right away. The estimate says $100 or 25%, whichever is greater, but what is your starting point? Starting point. The key answer here is the starting point for an estimate is what you would charge that patient should there be no coverage at all. And then what's the difference from that to the Medicare allowed amount? So let's use an air as an example. So I charge $3,000 for this air transport. Medicare covers $1,000 of it. My estimate is $2,000. You'll be responsible for $2,000. You could say $2,000 of the $3,000, whatever you want to do. Remember, I said it has to be within 25% or $100, whichever is greater. But they do add a caveat. Medicare adds a caveat for your estimate and says if you go high, it's better than going low, because think about it from the patient perspective. If I'm told I'm going to be charged $1,000, I'm only charged $500, I'm more likely to pay the $500. The other hand, if I'm chosen, I'm going to be charged $500 and I'm charged $1,000, I'm going to contact you and ask questions. So that's how the estimate works. Now, if you're using this as an optional use, stop there. None of the other stuff needs to be done. So if you're saying, hey, you got to do, or hey, don't do the rest of it. Okay. Now you got to do, or I don't need this, isn't part of the Medicare safe transports. You could have gone by ground, you could have whatever. That's where we want to stop. If you're using it as a mandatory use, and again, the one example that I have is air when ground would be medically necessary, then you want to keep going. The patient will pick the option here. You do have to explain it. This one basically says, yes, I want the transport. By the way, I want you to bill Medicare. Medicare will make a decision, and then you can bill me if need be. The reason that a patient typically chooses this is that it allows them to do an appeal to Medicare. Option 2 says, yes, I want the service, but you don't even have to bill Medicare, just bill me. This does not allow for an appeal, but it does make the patient liable. The reason that it doesn't have the appeal in there, because you didn't bill Medicare in the first place. How can you appeal something that wasn't billed to Medicare? And the third one says, I don't even want the transport. I don't want the transport. So the patient has to pick one, add any additional information you feel. The patient signs and dates it, or a representative signs and dates it, okay? So that's the basics of the form, the instructions, all of those types of things. We're going to jump right back to that PowerPoint. Delivery options. Medicare does state that you can deliver this in person, and that will always be your best option. However, they go on to say if that's not possible, you can do a telephone contact, mail, secure fax machine, or internet email. Now, I don't know in an ambulance world where you would not be seeing this patient, because remember, if they're not stable, if they're not all of those things, right, then you wouldn't even need to use this form. So really, it's more or less going to be in person before the service. Typically just before you transport them is very normal. Someone asked, I've used this because of routine scheduled transports to say, hey, it's not medically necessary. That's the optional use. And yes, you can deliver it. This once, it does count for all the time. It does not have an expiration date. Okay. So I'm going to open up for questions, but before I do that, I do want to give you one pre-submitted question that I haven't talked about. Why would one expect Medicare to download a claim without reviewing the patient care report? First, we talked a lot about this one, and that's the air to ground. The EMT came in and said, hold on, or someone on the air crew came in and said, yeah, they could safely go by ground, but the patient or their doctor insists they go by air. That does not make the air transport medically necessary. Doesn't mean that the ground transport wouldn't be medically necessary. Another time when you could expect this is if you've billed this before and there was a denial for a portion of the claim for not medically necessary. In other words, a portion of it was paid and a portion of it was denied. This will give you an indication that you have a not medically necessary portion to use an ABN for. Do you want me to put that into practical application? I'm sorry, I can't. I don't know of a situation where that's ever happened. I don't have any practical examples. No ambulance provider has ever given me a practical example. On the other hand, that is a CMS statement that we have to give you. So I want to make sure you're well aware of that. All right. Ashley, questions in the chat?
Hi, Tom. We did have a couple questions come into the chat. The first one is, we use ABNs a lot for home transports from hospital to home or SNF. What is considered to be a fully complete and valid form?
So the fully complete and valid form means that that when you look at the form, let me just pull it back up. It will be a little bit easier for me to talk about it. You start here at the top. You put your ambulance supplier's name as the notifier, the patient name. Again, optional for ID. You can have it. You don't really need it. Then you put the Ds, all of them. All of the D periods with the lines are completed. You then enter information for a description, ambulance transport. Why is it not covered or why is it not medically necessary at that level? And you give them an estimate. Now remember, if you're saying it's not covered because the transport itself is not medically necessary, stop there. Stop there. You don't need to do the rest. On the other hand, if you're going at a different level than for whatever reason than was medically necessary, a fully completed form means you continue down and you fill out these 3 or 4 lines. You can again remove the D period and the underscore. A fully completed form means that the patient must make a decision and check one of the 3 boxes. You do not need anything in additional information. You can put stuff there, but it's not a requirement. And also the last portion of a fully completed form is I and J, so the patient or their representative must sign and date the form. So when we really look at a fully completed form, it means that all of the sections are done with full explanations. It is signed, it is dated, it was presented, and the patient was given a copy. All of that is needed to make it a fully completed form. If at any given point you do not use the correct form date here on the bottom, it is not valid. It can be fully completed, it can be fully executed, done correctly, but if you are not using the correct form with the correct date, it is not considered valid. So hopefully I got everything in that. If not, throw some more information back in chat. We'll talk a little bit more about that. Any other questions?
We did have one more question, which was, is an ABN ever valid for a 911 call from a 911 dispatch center?
Yes, it can be. So it really depends on your area and how your 911 dispatch center is used. If every ambulance transport goes through that, it doesn't matter whether or not the patient is, calling 911, or are they calling to set up the dispatch? How are they doing that? So I can't say for sure in your area. Here's the thing. When we look at the 911 dispatch center, it's still based on the EMT assessment. Usually it's either you give an ABN or you don't. You give an ABN because it's at a higher level of medical necessity than needed. Really for ground, that's probably not going to happen, but it doesn't mean it can't ever happen. On the other hand, you don't give it if they're under great duress, because then it's not valid. You don't give it in a variety of situations. Also remember, it's optional if they could have gone by a different means. So yes, you can give it. I don't want to ever make a blanket statement saying, no, it was 911, don't do it. That's not true. Get your EMT there, have them assess, see what's going on with that patient, make those decisions. I will tell you, it rarely happens. I myself have never seen it happen, but it rarely happens. But again, I don't want to give you a blanket statement and say, no, no, don't ever do it, because that's never going to be correct with Medicare. Blanket statements are very hard with Medicare. Okay, any other questions?
We do not have any additional questions at this time.
All right, well, then we're going to go back to the slides. What we're going to do at this point is just keep right on rolling. So optional use. I really wanted to give you guys just a little bit more about optional use. Again, we've talked a lot about it. It's kind of your decision. And the reason we say, well, I shouldn't say kind of, it is your decision. You don't ever have to give this, ever. On the other hand, you can just to help the patient, to inform the patient. However, please use it correctly, okay? So again, it has to be contraindicated. In other words, if it's not the only safe means of transport, then it's an optional use. And again, we go right back to that Social Security section. I was asked for the reference for that. I'm going to finish up these few slides and then we'll stop and we'll talk about some of the CMS references in the next section. Do you have to complete the full sections? And the answer is no. We've talked about, oh, I'm sorry. Where is the patient informed of this? Medicare You handbook. If you're not familiar with this handbook, let me just show you where it is and what that means. Medicare You is on the medicare.gov website. So you may be familiar with the CMS.gov website. This one is medicare.gov. This is the patient's website. We're going to go ahead and close out of this. We're going to go to the basics. And it says Medicare You handbook under resources on the right side, last link. Medicare You. This handbook is something you guys are welcome to download, do whatever you need to do. I'm just going to go ahead and click on that download the PDF version. What happens is this is what the patient has to know about Medicare each year. You can see it's about 128 pages compared to what you guys get to know. Okay. So we're going to scroll down, and I'm not even actually, I'm going to just type the word ambulance in my find feature, and it will tell, oops, well, if I type it correctly, that is, it will actually tell me, okay, where are you going to find your ambulance services? 31 and 53. I can continue down if I want to and just find out all about what they have to say. So hopefully that kind of helps you out, but this is all the patient gets on an ambulance coverage. So all the stuff that I just went through and kind of showed you, look what they get. A little bit different there. But I did want you to know that that's why the patient doesn't have to have an ABM when it's a non-covered service. So that's what it is. Complete some sections. We talked about this. Again, it's A through F, making sure F is as accurate as you can get it. And we're going to stop back and go back to these optional use questions. So I was asked for specific scenarios of when they would give an ABN versus the optional use. And my answer is in most cases, the ABN, especially for ground, is an optional use. If this patient could safely go by a different means, then it is optional. One of the key things to remember is it doesn't mean that that means is available today. It could be 3 in the morning and they could still safely have gone by a wheelchair van, but the wheelchair van just isn't available at 3 in the morning. So they need to go to the hospital from the skilled nursing facility. That doesn't make it medically necessary. They could safely have gone by a wheelchair van. That's the Medicare criteria. It's nothing to do with it's available today. Okay. So I don't have a lot of specific scenarios, with the exception that we've already given, where an air transport was used when they could safely have gone by ground for any reason. Ground would have been the safest method. Therefore, it was medically necessary by ground, but they were taken by air. The patient is liable for the difference between the ground and the air. Ashley, any questions in the chat?
We did have one more question come in, which was, so if there was a 911 call for chest pain, but once they get there, the patient has chronic shoulder pain and has no other way to get to the hospital, an ABN would not be valid as this transport is not medically necessary, correct?
Okay, I'm going to change the verbiage slightly. I would not use the term valid here. An ABN could be valid. It would be valid for optional use only though, so you would do just A through F. It's not necessary though, because according to the EMT, it's chronic shoulder pain. They could safely have gone by insert wheelchair van, taxi, Uber, Lyft, whatever you want to say there. However, that method wasn't available, whatever the method is wasn't available. That doesn't make it medically necessary. That just means simply not available. So they are going to transport them. However, that transport is not medically necessary and therefore billed accordingly. Nothing to do with the ABN. If you do give an ABN, it is an optional use. I mean, totally described a perfect optional use in this scenario. So that's a great optional use question. Any other questions?
We do not have any additional questions at this time.
Okay, I'm going to give you guys a few resources because I think they're pretty important resources. Oops, sorry. And the resources are going to be available on the website. So while we do kind of look through and we will navigate some of the slides, I'll mention the slide and then kind of take you out to the different resources because I think that's important. On slide 24, it just introduces resources and what we're going to talk about. On slide 25 is the slide that actually navigates you to the CMS website. And it gives you the steps. How do you get Medicare forms and notices and BNI? I already took you out there for this one. We already showed you what the page looks like, which is here. So I'm going to go ahead and skip this one unless you need me to go back to it, but then you got to add a question to direct me back to what you need from it, okay? The next resource is actually the manuals, and I do want to cover these because they're very important. When we talk about the manuals, we are going to go back to the cms.gov website. We're going to leave the ABN section and scroll back to the top. The manuals in this case are the internet-only manuals, which are also the day-to-day operating instructions for Medicare. So we'll go Medicare, regs and guidance, regulations and guidance, and manuals. Okay. Manuals is the first link in the left, or the body, the first link in the left column of the body. That's what I should be saying. Then you're going to go internet-only manuals. One of the first things you want to be aware of is just which manual do you want to look at. I'm going to start with the benefit policy manual, which is right here, 102. The reason that I like this manual is if I scroll down, there is a whole ambulance chapter, and it talks all about the things that make an ambulance transport medically necessary and covered by Medicare. Oh, that's right, because it has to be medically necessary for Medicare to cover it. I will tell you, without the documentation, we won't consider it because it's not considered medically necessary because it's considered an undocumented service. But it'll walk you through everything you need to know. I mean, the vehicle, the crew, it's necessary and reasonable, all of those different things. So there's just a lot in this one. It talks about the different destinations of what are covered and what are not covered. Please keep in mind that that is part of the requirement. Don't give an ABN if it's a non-covered destination. That doesn't work either. So it'll just talk about some of those different areas you might want to know. Along with the benefit policy manual, I always recommend that ambulance suppliers look at the Medicare claims processing manual, and inside there they go to chapter 15, which again is another purely ambulance chapter. And it talks about all the things that we as a contractor have to look for to pay you. So it makes good information. Start with the benefit policy manual, move to the claims processing manual, and see how all of that works together, okay? One of the areas that's really good is this documentation requirements. It is a starting point. However, we have a much better example on our website that'll help you through that documentation stuff. All right, another one within the claims processing manual, if I scroll all the way down, is chapter 30. Now, this is the financial liability section. This is where it actually contains information on the ABN. That's in section 50. So we went through the use and whether it's optional or mandatory. That's also going to be in here. We just jump down to that section. Here's the ABN uses. So here's where it says medical necessity. It's nothing particular about ambulance. It just says it's medically necessary. But then here's where it says that if it falls under section 1861, it's an optional use. And remember, I said the ambulance benefit is defined in 1861 S7. Therefore, it's optional unless it's a medically necessary transport. Okay, so we want to make sure we're well aware of that. And that's where we get the 1862 A1A medical necessity. versus ambulance transports, which fall under 1861. Hopefully that all kind of ties together and makes sense. You can go through all of the different items and notices within this. I don't like to scroll through. I'm a big one for using find. So you can see if I'm looking for certain pieces of information, if I use the word ambulance, it will bring me to what I need. So technical, this is what we just talked about. Okay, ambulance companies may not give written notices to beneficiaries in an emergency transport because such beneficiary is under great duress. Well, that makes sense, right? Patient's not able to understand what you're giving them anyway, don't have to do it. Ambulance transports, and it goes through the questions, the criteria, all the things you want to know. I will recommend that if you haven't taken a look at this, this is just a great generalized overview of the information that we just went through. Okay. And again, you can see I'm just kind of scrolling through everything, but so take a look at that. It's going to give you a lot of good information. Also on the CMS website, one of the areas, and I'm just scrolling back to the top, so I apologize for that, is the Ambulance Service Center. I do like this. I typically search for it though. I don't really want to have to guess through everything. So again, the Ambulance Service Center. Ambulance Services Center right here. And it's just a good information to get you a bunch of links very quickly to everything you need. Okay, so you can get a lot of great information, a lot of important education and different things like that without having to move through and try to dig out where things are at. Was asked for a good source to get fast information. How can you find some fast information? This is one of my favorites. Okay. I do want to show you another one on our website, so bear with me as we go to that. Again, leaving our website, if we go to the trainings, or leaving the CMS website, going to the WPS website, we do have some different articles that may help you. Biggest one, the training center right here. Scroll down to specialty and services. And then the first link is for ambulance training. It's a series of lists, articles, all of that, that will help you, series of links, other things that will just help you get the information you need very quickly. That's why we recommend it. That's why we like it a lot. If you want more on documentation, this is just an article specific. Here's some billing, here's some benefits. So take a look at the different things that are here for you. Just a great opportunity for a variety of different things going on WPS's website as well. All right, that brings us to, let me catch my slides back up again. That brings us to the final use question and answer. So what other questions do you have? Again, go ahead and add them into the chat. But Ashley, what do we have for questions?
We had one more question come in, which was, would you use an ABN for excess mileage if the patient wants to go to a specific hospital that is not the nearest hospital?
No, excess mileage is a separate code for not payable. It's in a separate section of the Social Security Act. It's not in 1862, so you don't need it. You would want to make sure you build the appropriate code, right? And so I think it's an A0888 if I remember correctly. Let's look that up just to make sure I'm right on the money there. But I'm pretty sure because it's the A0888 code. Yep, this one is because it's non-covered mileage. It means they're outside the statute benefit. You don't need it. I also want to make sure I keep saying you don't need it. What does that mean? It's optional use. So could you give it? Hands down, yes, but you don't need to give it. Okay. Remember, it's not just the patient's choice. It could also be the provider's choice or the doctor referring them, whatever the situation is. That's the nearest appropriate facility. Keeping in mind locality also falls onto that one, and we can talk more about that if anyone has questions, put that in the chat. However, in the meantime, I'm going to jump back. Ashley, anything else?
That was our last question in the chat.
All right. So a couple of final thoughts. One, an ABN is not required for a service that is not covered by Medicare. In other words, it's not a medically necessary transport, which means that the EMT assessment showed this one could have been done by different means altogether. It couldn't have been done by ground, or it could have been done by wheelchair man. It could have been done by taxi. It could have been done by private citizen car, whatever the situation is. On the other hand, the ABN is required when the transport is medically necessary. but above the level of care provided. The only example where we see this is when a air transport is provided, but the ground transport would have sufficed for medical necessity. One of the common examples is if you look at the total time package to get them there by air, why was it medically necessary to wait for that air transport when we could have had them there by ground faster, sooner, quicker? Also, there is no real need for the air transport, but a doctor or a physician or a non-physician practitioner, somebody is ordering it. Therefore, the patient insists upon it. Yes, they're cognitive, they're awake, they're stable, but they do need it for medical necessity. They do need it to go to a higher level. We're not saying they don't need that portion of it. We're just saying they don't need to go by ground, or they don't need to go by air for whatever reason. Those are really the only times that I am familiar with when that comes up and when you should use an ABN. All right. A couple of things I need you to be aware of in just a few moments. You're going to be getting an email. The email does contain your certificate of achievement. We do not give you CEUs. So I was asked about NAC and if we give NAC CEUs, the answer is no. We are an approved vendor, but what they do is take our contact hours and translate them to CEUs. How much they translate one contact hour for this event into CEUs, I don't know. So you have to contact them to find out. If you have a different area where you get CEUs, please contact that vendor to find out as well. But in that certificate of achievement or that follow-up email that you're going to get, there's also a link to a survey. I'm going to give you a bunch of other options for the survey too, so hold on to that. But we do want to make sure you're aware of that link, that it does exist. You are welcome to send follow-up questions to us. I will say Ambulance ABN webinar in the subject line. Ambulance ABN webinar. Why is that so important? Because you want to make sure it comes to me and you only get 7 days to send those follow-up questions. If you put ABN for ambulance webinar, good. I just need somehow to indicate that it's the ABN webinar portion. And then we'll get you emailed back with those. At this point, we have answered all questions that we got pre-submitted and in chat. So I don't have any more to offer there. Survey, please take our survey. Again, I'm going to have Ashley put a link to it in the chat. You can do it that way. You already saw one method, which was through that follow-up email. Another method is going to be that when we close out of the event, there's going to be a pop-up box. It's going to look like the bottom box on your screen. It's going to say external site, and it's going to give you the opportunity to take a look at that survey. Please do take a look at that survey. We just want to make sure that you're aware of it and that you are taking it. Also, if you're watching this in an encore presentation or when you watch this again in encore, you will be given the opportunity to take the survey again, and that's using the online survey picture, which is the upper picture on this slide. We really just want to know what did we as WPS do well? There'll be one question on that, grade your MAC. What did I as your presenter, advertiser, etc. for this webinar do well? And you'll get a series of questions on that. What could I have done better? If anything, it's the same series of questions. And then you'll be given the opportunity to grade the PowerPoint, the resources that I showed you, because I did show you a bunch of website stuff, all of those different types of things. So give me the good, the bad, and the ugly. We do want you to know that we do hear you. So when you put comments in there on things you would like to see us change overall, anything like that, also comments on what type of education you want, we listen. We try to make changes based on those. The latest two that we did were the chapters in the YouTube channels, which will break every video down into smaller chunks when they're fairly long. And fairly long is usually about 5 minutes or so. And then we also added training indicators. Now the training indicators are used just to help you gauge whether or not this is important training for you. So those are some things we've done. Again, we are looking at more information, we always do. But again, if we don't know what you want from the survey, if you don't give us comments, I can't fix it. Okay, can't fix it. One thing I'm going to give you a recommendation. If you want me to hear you, if you want me to make education changes, if you want me to offer additional education, please don't say ambulance education. I don't know what to do with that, as ambulance education is a broad spectrum picture. If there's something particular that you want, let's hear about it. I want ambulance in the ABN. I want ambulance EMT assessments. By the way, that's coming up. I want those types of things. So keep it more specific. So thanks for attending. But before I let you go, I just want to remind you that you should or really will want to consider, if you are looking for medical necessity information, go to the training center on our website. Inside the training center, there is a course coming out, and it's EMT course, actually. It's called EMT Assessments. I'm just trying to find the date, so I apologize for not having that off the top of my head. Oh, it's not advertised yet. So what we're doing is we're looking at doing a course that will be just purely emergency medical technician assessments. Sorry, that course will be available on 10/1. So it's not quite advertised yet, but it is coming forward on October 1st. Watch for that to come out. It's usually 4 to 5 weeks before the event. So take a look at that. Make sure you're getting all of that. Thanks for listening. We do want to encourage you again, provide that feedback. We'd really like to hear what you'd like us to do, see, change, do whatever you want to do. Remember to review that live events page again on 10/1. So a couple weeks, watch for that next ambulance course coming out. Don't forget to review our encores and our playlists that go with those. On behalf of myself, Ashley, and all of WPS, thanks for participating. We look forward to your survey comments and hope that you'll join us in the future. Thank you, and you may now disconnect.